Hi, my name's Lisa Brown, and I am doing my speech on CPR for an adult. You would want to start with, if you notice that someone's unconscious and they need your help, the first thing you want to do is assess the scene, make sure it's safe to approach. If it is safe to approach, what you'll want to do is protect yourself first. You want to wear gloves to protect yourself from anything, any disease, anything. So you want gloves, and a mouthpiece is something that you can carry on a keychain along with the gloves for the mouth-to-mouth. You would want to, it's a sheet that would go over their mouth, and you can breathe through the sheet, and it would protect you from any disease that they might have. CPR lasts from beginning to end about 2 minutes. You go through 5 rounds of 2 breaths and 30 compressions. The adult breathing rate is 100 breaths per minute. So you're wanting to do this real quick, these 30 compressions, to get blood circulation going. The first thing you want to do is see if the person needs help. You want to ask them, do you need my help? And if they don't answer you, then what you want to do is shake them and say, hey, do you need my help? Well, obviously if they're not answering you, they're unresponsive, and they do need your help. You want to automatically say, if you have other people on the scene, I need you to go call 911, and when you do it, I need you to come back and tell me that you called. And if you have another person, say, I need you to go to get an AED if there's one on the scene, or if there's one in the building. If anybody knows, try to go get an AED, because AED is very helpful. The next thing you need to do is begin the CPR. If you see somebody unconscious, what you're going to need them to do is open the airway. You're going to need to check their pulse. You need to give 30 compressions per 2 breaths. You're going to want to press right on the sternum bone, right between the nipples of a man and the breast of a woman. You would want to hold your hands just like this. Make sure this way for me, and press the palm of your hand on their sternum 1.5 inches to 2 inches deep to get blood flow going. I'm going to do a quick little demonstration just to give you an idea on what you would do if you saw somebody unconscious. And Nicole's going to be my patient. Okay, as you can see, Nicole is on the ground, unconscious. I would assess the situation that it's okay for me to approach. There's no danger, there's no fire or anything like that. What I'm going to want to do is say, ma'am, do you need my help? And being that she's not answering, she's unresponsive, so you want to shake her. You don't want to touch her until you ask her first if she needs your help. You shake her, ma'am, do you need my help? She's still unresponsive. So the first thing you're going to want to do is say, I need you to go call 911. I need you to go get an AED. And when you do these things, I need you to come back and tell me that they've been done, so I know emergency help's on the way. Okay, so with Nicole, what I would do is I'm going to want to open her airway first, just in case her tongue is resting on the back of her throat or closing her airway in any way. And her mouth automatically opens right there. So the next thing I'm going to do is listen for an airway or feel for a breath. And I'm going to pretend that I don't have a breath happening right now. And what I would do is feel for a pulse. And if you feel for no pulse, obviously you need to get circulation going right away. So at this point, I would give 2 breaths, and then normally you would take off or open up their shirt and feel for their sternum. Put your hands just like this. Get the palm of your hand down on her sternum, and you give compressions 30 times. It's really quick. And then do this 5 times until emergency help would arrive. So Nicole can get up. Thank you. Another thing that would come up is if you had 2 emergency responders on the scene. Something you could do is 2-person CPR. This is when you would have one person at the head and one person at the chest doing 15 compressions to 2 breaths. So, and usually the second person would have a air. An ampu bag. I'm sorry, I can't remember what it is. It's ampu bag. And they would press in 2 breaths, and then you would get 15 compressions, and you would continue this until you get them back, or the AED gets there. The AED is the electrical shock to get the heart rate going again. If anybody wanted to do get CPR training or first aid training, JCC offers a 10-week course. That's what I took. So in the end, I was CPR certified and first aid certified. And if you want to do something shorter, you could do it at the Red Cross, or I believe you can even do it online too if it was something that you just wanted to do online. But I'm just about wrapping up here. Does anybody have any questions?
Yeah, you keep saying if you send somebody to get an AED, I mean, where would one of those be? I mean, is that...
A lot of times they're in shopping malls, they hang on the wall. And it would be labeled what it is. Just like a fire hydrant. You would see a fire hydrant, you know exactly what it is. This would be in a box on the wall. A lot of times they're in malls, they're in supermarkets, they're in hospitals.
Do you have to have training to be able to use one of those, or can
Yes.
anybody use one?
You would want to be trained before using it, because you could really hurt somebody if you didn't know how to use it. It's electrical shock.
Would you be responsible if something happened and it didn't work out?
It's kind of touch and go. Like, if you go to help somebody and let's say you're in uniform and you didn't help somebody, you could get in trouble for that. But if you did go to help somebody as a first aider, then there's Good Samaritan laws that would protect you. But in some cases, there can be some suing if something went wrong. But a lot of times you're protected with Good Samaritan law.
If you were to go to the Red Cross, would you be certified?
You would be certified. You would get the same certification, only it wouldn't be first aid CPR, it would just be a CPR certification. I believe that's like a week or 2 course. Anything else? Okay.
Thank you, Lisa.
Thank you.
How do I stop it? Just push stop out.